First on Health Matters, how concerned should we be about some of the illnesses spreading rapidly around the country and the world? And do they pose a greater risk than more common diseases we deal with every year? Joining me is infectious disease specialist Dr. Stephen Threlkeld. Thank you for being here today.
Good to see you.
Dr. Threlkeld is one of the smartest doctors in the whole Baptist system, this man right here. Okay, now, we've heard all the news, all the stuff about Ebola and the enterovirus. First, tell us a little bit about the Ebola and the infection and what's going on with that.
Well, naturally, epidemics tend to strike the fancy of people in the news and in the public, and with good reason in the Ebola case. It's a horrible illness, and we've all seen the pictures from Africa, the outbreak, particularly in Liberia. It's horrific, and the images are very real, and it kills people at a rate of about 50%. So it is killing literally, potentially thousands of people there, and it's sort of stayed ahead of the ability of the public health system to maintain control. Both the government's there and even the CDC and World Health Organization helping out. So the danger is that it goes from the rural villages where there are smaller numbers of people into areas of higher population density where it might spread even more efficiently, and it's very frightening there.
How big of a threat is Ebola really to the United States?
Well, despite how horrific it is there, it probably is little threat truly to the United States. I don't doubt that a person could get on an airplane, and almost did in one instance already, could get to the United States potentially with the infection. The fortunate thing, and one of the only fortunate things about the infection is that it's not terribly contagious. You really need to be exposed to people's blood or body fluids. So healthcare workers, families, and close friends caring for infected patients, or even disposing of the bodies of people who've died of the infection, is a common way that it's spread there in Africa right now. All of those things would probably be fairly easily controlled in a place like the United States, where we have excellent infection control measures and facilities that are set up to handle this situation.
Well, the next topic is, what about this enterovirus that children are getting? We're seeing pictures of children on ventilators and face masks and things like that. Tell us about that.
Enteroviruses are an interesting group of viruses. Polio, for example, is an enterovirus, and this, of course, is much different from that. But it's a complex group of viruses that cause a number of different types of illnesses, including viral meningitis and other kinds of illnesses as well. This is primarily a respiratory illness, enterovirus 68, first identified out in California in 1962. It's been relatively uncommon, and not a lot has been really known about it. But since about 2008, 2010 time, we've seen a couple of outbreaks in the United States, Europe, and even Asia, so we've noted that there have been a few more of them. And now this outbreak has been in 18 states and infected at least 150 or more known kids. And it seems to be much worse in children with asthmatic potential, those who wheeze or have a potential to wheeze in the past. They tend to get a lot more ill. Many people, it's important to point out, don't get very sick. It's more like a cold, a minor respiratory illness. But again, those people with underlying lung problems, particularly asthma, can get very sick and require hospitalization and even ventilatory support.
And protection and prevention for this would be?
There's no vaccine and there's no specific treatment, so it's good old-fashioned hand washing. And so washing one's hands with soap and water for 20 seconds, sneezing into the elbow rather than the hands. Don't hug, kiss, or shake hands with someone who's otherwise ill. Parents, keep your kids away from school for a day or so if they do have a significant respiratory illness. All those things that we know to help avoid the cold or the flu, those kinds of things would apply here too.
Well, what about the flu season coming up? What are we looking at? What's the predictions about that?
It's the tough thing about the flu. It's hard to predict. The severity of it, where it's going to strike first, when it's going to strike exactly, they can be very difficult. We try to predict that with the particular vaccines that become available right in the fall every year. We try to predict which viruses are going to be the most common, but it's very difficult to do. And usually it can be a minor illness, but up to 49,000 people have been documented or felt to die of the flu in the United States in 1 year, even once. And as Dr. Craig will point out later, it can be a life-threatening illness and a deadly illness to a lot of people.
Now, the last question, this is the most important question, does the flu shot give you the flu?
No, it's a common misnomer. There is no, now let me say this, I always said before, the nasal vaccine, that the flu shot doesn't have any flu in it. It's chopped up pieces of the flu, cannot give you the flu. One of the problems with that is that if you don't get the vaccine early enough, it takes about 2 or 3 weeks to take effect and give you some degree of immunity.
You could get the flu in the interim.
Flu between the time that you get your shot.
But the flu shot will not give you the flu.
It will not, with the exception, of course, not really an exception, but the nasal spray vaccine actually will give a very small small, controlled, isolated local infection in the nose that allows the immune system to keep the regular flu virus from causing any larger scale infection when it comes along.
Well, thank you so much for being here with us today. And I told you Dr. Threlkeld was smart. Next, how a special pump is saving the lives of patients suffering from common infectious diseases. Stay with us on Health Matters.